Welcome to my physical review webinar. This webinar is going to take us through all 3 pages of the physical. As you know, this is a requirement, state mandate. We have to have our physicals in by certain times. We're going to take it another step forward and look at what the physical actually means, what we need for the state, and then also what we need to know as daycare providers to be able to better serve our families and the children that come into our program. So I am going to share my screen with you now and get to my PowerPoint presentation. Just give me just a quick second as I figure out how to do this. And we're going to play from the start. Okay, perfect. Okay, so physical review. So our physicals have 3 pages, right? The first page is very important information. We want the parent to fill that out. So the parent is going to completely fill everything out from the top to the bottom and sign the first page. That is a state mandate. It should be signed and dated. So as you're looking at all this information that if you can see, it's just the general information right on top, but right in that middle section is what the parent is telling you about their child. Now, this information is not easy to get in Spanish. However, some doctors' offices do have them. If you can get your hands on them, keep it as a reference. You want the parent to be able to understand, or if you're able to translate for the parent, that's fine too. But you want to make sure that that information is not just being checked, that the actual parent knows what they're filling out, because that's going to tell us information about the child that may not be on the physical. So I see that oftentimes where a parent will say that a child has a certain disease, has had allergic reactions, has had difficulty breathing, and has asthma, but that is not on page 2 of the physical. So that's why this page is very important, um, and something for us to like have conversation with and to find out more information about. Because if there is something that needs individual health plan, you can sometimes get that information out before that child starts at your program. So just kind of keep that in mind. I did ask the Office of Early Childhood if they had a Spanish copy just for reference, and they don't. So I hope that they're working on that, because we want the parents to have that in their own language. The whole thing should actually be that way. But page 2, it's going to give us all the assessment information, and we're going to get into that a little bit more. And then the third page is our vaccinations. I'm also going to break that down in a lot of detail. So a lot of this, yes, it's state mandated and we have to have everything filled out, but it's good that we know what it is to empower our parents and to be able to make sure that their children are being cared for safely. So just so you know, just a little side fact, because I get a lot of questions on what is the date of that we're looking for to know that when it's expired. So I hope that's making any kind of sense. I'm jumbling, but right here is where it says date of exam is the date that we go by. So if it's a year from that date, it's going to be that one. It's not going to be the dates that are written down here. That's what the doctor fills in. That could be filled in at any time during pickup of the physical. It's not going to be over here. That's where the parent fills it out. It's going to be right on top of here where it says date of exam. So just keep that in mind. That's the expiration date that we are going to be concerned about, not anything else. So just looking at this slide, we're talking about how fast children grow. So this is why it's so important that we keep those well visits and we try to get that second page and the vaccination page every single time a parent goes for a well visit. Now, we need to educate our parents, because even though the state only requires an annual physical, as Head Start, if you're affiliated with Head Start, or even just because we need vaccinations for our state mandates, it is best practice to, at every visit, get that second page from the parent and also the vaccinations. The first page, I don't want to be confusing, is good for a year. So that first page where the parent filled out, that is good for an entire year, but the rest should be updated as the child goes. So here is the schedule. So it's right here on the second piece. The children should be going 2 months, 3 months, 5 months, 7, 12, 19, 24. Now, with that being said, there is a little bit of leeway when we get fast forward to the vaccination portion of this presentation. Vaccinations are sometimes done a little bit ahead of time, so you have that wiggle room for maybe like an extra month or two. However, you want to stick to this schedule as much as possible because so much happens in 1 year of a child growing. Look at this little infant over here, and then look at these little 1 year olds over here. They're it's incredible. So we're looking at all sorts of things to make sure that this child is healthy within that year. And so many things are discovered, which I know you know, within that first year of life, in reference to like allergies, health conditions, asthma, things like that. So just keeping that in mind that we do want to follow up with this because if there is something that comes up and God forbid the parent forgets to tell us, we are on top of it. So keep that in mind. But just looking at something as simple, and this is on the second page, height, weight, and head circumference. Let's know what that tells us. So yeah, it's telling us that the children is has good nutrition status. So that's so great. We want to make sure the children are healthy and growing properly. But it can also tell us if something's wrong. So the head circumference is important to monitor the proportion of the body because there could be excess fluid in there. So the child could have fluid in their brain, which has happened. I've seen it. The fontanelles may not be fusing properly. There may be developmental concerns due to this. So what we sometimes do see children with abnormally large heads, and maybe we were not really paying attention that that could indicate something. So it's good if that child wasn't going to their physician, that may not be monitored, that may be missed. So that's another reason why we want to encourage our parents to get these well visits. Vision and hearing, if you're part of Head Start, yes, we do that, and that's great, but it's always good to have the physician's assessments as well. So more assessing is better than just one. They could be wrong, they're not always accurate. So we want to make sure that any kind of vision or hearing, even though I know that the physicians do not always fill this out, but we can encourage the parents to ask for it when they go. More physicians are having those almost the same kind of equipment that Head Start has. So the vision screeners and the Welch Allen ear screeners. So keep that in mind. Or they think they use Spot Vision Eye, but regardless, it's all similar. So we want to get those second opinions. We want to keep, if there is an issue, we want to get those children referred because if they can't see or if they can't hear, they're going to have a very difficult time developing and growing in school. They're going to have difficulty with coordination. They're going to have difficulty with speech. And so thinking about that in a sense of how they're going to function in the classroom, what happens if a child can't see or hear properly? A lot of times there's not, in addition to the speech and difficulty with identifying objects, they're going to have behaviors. They're going to get frustrated. They're going to try to communicate, but they can't. So, kind of thinking about that when it comes to early intervention and prevention as well. Hemoglobin is very important. Hemoglobin, when we're looking at this lab value, and I wanted to make sure that I actually added these values right down here because a lot of times like you'll see the hemoglobin. Now it says hemoglobin and hematocrit, but they mainly put the hemoglobin down there. I don't think I might have seen the hematocrit once. But these, what does that number mean? I put down the range on here. So for 6 to 12 months, we're looking at 11.3 to 14.1. That is normal. Anything below that is anemia. And what is anemia? So when we're looking at anemia, it's oxygen perfusion. So if you're not getting the oxygen going through your body, you're going to be sluggish, moody. You're going to have the color of your skin is going to be pale. You're going to be tired. You're not going to be performing at your best. So this may just be like a simple quick fix of, mom putting the child on supplements or having, some red meat or any kind of protein, things like that, that could boost that up. but to be aware of it and to know that, okay, if something's not right, are we following up on that? Because it can get serious. You want the oxygen going. We need oxygen. It's important. But just having, even ages 1 to 5, 10.9 to 15.0, now you know the range. Because otherwise, I remember looking at physicals when I first started doing all of this and being like, what is so important about this number? And if the doctor doesn't put it, what does that mean to me? Well, this is what that means. So I wanted to make sure that I put that in here. We do want those values, and we do want to make sure that we are monitoring them. When we go to lead and tuberculosis, so lead, and for whatever reason in this community or Waterbury community, which is near the majority of us, I have found that the lead levels are more, they're high. They're more than other towns. So just like keeping that in mind, that there is a trend there, and the goal is to not have any trace of lead. Now they changed it. It used to be below 10, then it's 5 or below. But really you want it to be none, because even they're having studies now that even traces of lead can cause serious damage. So we want to get those values in by the right time. So it's usually, I think it's like 1 years old, they can start doing lead tests. A lot of times the lead is not being done in the office. So the parents have to go out to like a Quest or something to go and get that done. And we lose those results. We don't get them. So it's important that we do, because and just to kind of put it out here, what some of the signs and symptoms are: belly pain, headaches, vomiting, confusion, muscle weakness, seizures, hair loss, or anemia. So it's connected with the anemia. So that could be a cause if a child is anemic. And then just knowing what that is, that might be you might just think this child has a stomach bug and not even know that the child has lead, because we just have never been able to monitor it because that result never came in or the parent never did it. The CD has stated that these low levels can affect IQ, ability to pay attention, and academic achievement. How many children do we have that can't pay attention? We just kind of brush it off as there's some sort of behavior issue or developmental issue. It could be this. So just knowing that this is a possibility is important. Just to kind of keep in the back of your head that this can be monitored, it can be prevented. If we do come across a child who has an abnormal level, the doctor, you just ask to make sure that there is some follow-up. Of course, I don't feel like the doctor would not follow up, but you want to make sure that, just ask, is there any follow-up? Is there a plan? Are you going back to get retested? And then make sure you write that on your calendar and then just follow up with it. There are things that they can do with the Office of Early Childhood to get resources to, have like maybe their landlord or somebody come in and do a lead abatement. So keep that in mind. TB. So we never know. Sometimes it's our families, if they are traveling, if they're exposed to TB. So the doctor needs to determine if they are at risk. So that box needs to be checked. There are times that it's not, and that's not accepted in any of our programs. The state wants that box to be checked. So with that being said, you can always, give it back to the parent or call the doctor and just get a verbal, see if, say who you are. And if they do give you the information, that's great. You can check the box and put your initial on it, and the date that you called, or you're going to have to give it back to the parent, unfortunately, and have the doctor check that box for you. So that is very important. The state does require that box be checked. God forbid that there was any symptoms, coughing, or the child needed a chest x-ray or any kind of follow-up, that is something that you make sure that you are following up on as well. You never want to have your other children be exposed or yourself to any of these things. So dental concerns and developmental assessments. So dental concerns is on that second page. Now, granted, we want our children to go to the dentist by age 1, or that cut of the first tooth. So as soon as that tooth starts coming down, we want that child at that dentist, and we want them there every 6 months. Like, that is ideal in a perfect world. Doesn't always happen. So it is great that the doctor fills out that they've looked in their mouth. So checking that off, sometimes the doctors will make a referral. They can see very easily if like a child has any kind of rotting cavities or anything like that. And it's also good communication for the doctor to also reiterate the things that we're trying to tell the parents, which is to go to the dentist as well. So that's why we want that filled out. Any early intervention is helpful. Um, and then, of course, if they have, if their teeth are being taken care of, they're not going to have cavities are going to cause any kind of discoloring or infection, speech, nutrition, and ability to concentrate in class. Like all of this stuff really comes together. So, again, it's prevention. We want to, even ourselves as providers, look in the children's mouths and just always, these are constant ongoing assessments. These things change so fast. We don't know the habits of what's going on at home. So, it's good to have these conversations. Um, Developmental assessments, that is a state mandate. So those assessments need to be done at the doctor's office. It's like right in the middle of the second page. So this is going to determine if the child is meeting their milestones. So we know that that's a big push in the OEC. We all got that one page handout that says what milestones need to be met by what, you know, age group and all that. So that needs to be filled out by the doctor as well, because they're also doing other kinds of screenings. They're doing autism screenings. They're doing all kinds of things. So we want to make sure that we're all on the same page. And you will get dinged if that's not filled in. So there are a variety of different assessments, like I've mentioned. And then once we know this information, we can do referrals. We can refer right away to birth to three. We can make sure that early on, if there's any abnormality, that we can get the child some sort of service to make sure that they are on track or get back on track so they don't lose, they don't wait too long, and then it's even harder for them to be successful. So the chronic illness section, this tells us a lot of information, and this is forever changing. So you want to make sure, like when you're looking at that physical, you're going from the top to the bottom and making sure you're looking at everything. Because just because they didn't have asthma last time they went does not mean they're not going to have it this time, or an allergy, or what I'm telling you, I've seen, I can't even count countless amounts of physicals and have monitored many, many children. And I want to say it's not rare. There's changes all the time. It's very common that these things change within the first year. So looking and making sure, looking at those allergies, asthma, diabetes, and seizures. Um, when you're looking at the chronic illnesses, you want to make sure that um, if there is any concern or something checked on there, that we are making an individual health plan to accommodate that. So if we need a medication, we have our med form, we have our log sheet, we are going to do our individual health plan if we need that. We make sure that we have everything that we need before that child is able to be in your program. Because if you don't and you get inspected, what's going to happen is they're going to see that on the physical, and they're going to ask you for an individual health plan. They're going to ask you for your medications. They're going to make sure everything matches, that's signed, it's dated. And if it's not, that child's not safe in your program, and you are going to get dinged for that. So I just want to kind of explain that in a way that it is very serious. We are looking at these things for the child's safety. So if a child has allergies and is allergic to apples and gets an anaphylactic shock, or it goes into anaphylaxis, you want to make sure that you have whatever the doctor says. It could be Benadryl, EpiPen, because you do not want to take that risk of that child getting exposed to those apples and potentially not breathing and having to go to the doctors or worse. So it is a real thing. It's scary. So we just want to make sure we're paying attention. So our vaccination schedule. So we have all these vaccinations, right? Parents, there's always something missing on the physical. There's always something happening with vaccinations, people missing appointments, refusing them, things like that. So it's good to kind of see. Now we've been talking about vaccinations. We've been talking about wellness schedules, and you can kind of see here all of those wellness visits. We have 2 months, 3 months, 5 months. It all matches with this, and then this is what needs to be completed by this age. So just to help read it, if we need to give the DTaP, and we'll get into what these mean too, because I feel like it's important to know, what are these vaccinations? When we say DTaP, what are we talking about? So let's just say the DTaP. We need to know if the child's on schedule for that. So let's say our child is 12 months old, so a year. We'll make it easy. So we're going to go over here in front of my little cursor here. So we're DTaP. Our child's 12 months. So here's 7. Here's 16. So by 7 months, they have to do this by 6. So we can go right here. So we'll go by the 7 months because he's only 12 months. So that child needs to have 3 doses of the DTaP, okay? Now he's 16 months. What does he need? Still 3 doses. 16 to 18 months, still 3 doses. But by 19 months, he's going to need 4 doses. So that 19-month birthday, this child needs 4 doses. So I hope this makes a little bit of sense. Our polio, let's just say the child comes into your program, he's 6 months old. How many doses of polio does he need? So I go to my polio, I go over here. So he's 6 months, so he's in between 5 and 7. I'm just going to look at it. So 2 doses for 5 months. So we 2 doses, then 6 months, 2 doses. So he's good at 2 doses. So you just kind of go through. And now if he was, let's see, by 19 months, he's going to need 3 doses. So we just need to let the mother know that by 19 months, we need the 3 doses. And you just kind of go down as you're, going through your list of vaccinations and just making sure that the date of birth and the vaccinations all match up. So I know it's kind of a little confusing when you're looking at it. Some are done, some need booster doses after the first year. The more you look at it, the easier it is. So I put this to make it a little bit less confusing, in Spanish as well. So I hope that might be a little helpful when it comes to this. The vaccination names themselves don't change so much, but I'm hoping, the Spanish in here helps a little bit as well. So if you have any questions on vaccinations, or you feel like, because it does get confusing, please reach out. So let's talk about what these mean, okay? So when we tell someone, a parent, they should get the DTaP, well, what is that? It's diphtheria, tetanus, and pertussis. Some of these we know, some of these we don't know, but we are going to learn them, because when a parent is sometimes refusing a vaccination, we need to reiterate the importance, or reinforce the importance of why these vaccinations are important. So, when we talk about having like immunity, children who are not vaccinated, I just want to kind of make this a little bit clear, the ones who are medically not able to, really religiously not doing it. So they have the right to not do that, but there are certain precautions that we should let them be aware of, and then to know in our own centers and homes about these vaccinations. Because if there was ever an outbreak of anything, you have your children who are vaccinated, they're fine, but the children who are not vaccinated are not fine. So you need to find out, can I even keep them in my center? They might have to be out by a certain amount of time. So you're going to want to contact your Office of Early Childhood if that was ever to happen. Usually it's like flu or like a chicken pox kind of situation. Those are probably the more popular ones, but flu, you're going to want to keep the child out. There's a certain amount of time, and you want to make sure, that child is protected. So just knowing who's vaccinated and who's not is step number 1. And then keeping in contact with the Office of Early Childhood if anything were to come up, for tracking, and then also for follow-up for the family and for yourself. You want to look at the bigger picture. You want to make sure that you and your children and your family are safe, and you want to make sure that the child who is infected is safe as well. So, keeping that in mind, just in the back of your head with the DTaP. So, diphtheria. So, diphtheria is a serious infection caused by strains of bacteria called, I can't say that name, Corynebacterium diphtheriae, that make poison essentially. So, it can lead to difficulty breathing, heart failure, paralysis, and even death. So that's something to know when you're presenting that to a parent and saying, this is what this is. You want to take that into consideration, what we're talking about. Tetanus, so that's an infection also. It produces poison. No, mainly known as lockjaw. So I remember like a lot of times, like we would talk about like stepping on a nail outside, which has happened to me. I have been the one, of course, to step on the nail, walking on lumber and all that. And yeah, you have to get, if you're not up to date on your tetanus shot, you have to go to the doctor and get that. So just even knowing that, if a child in your home or center ever stepped on a nail or you found out that they did, that's what this vaccine is for. It's protection against that. And actually, since I had the tetanus vaccine, I did not have to do anything else after that. But it's just good to know what it is. Pertussis is a big one. That's whooping cough. So when I know like even a lot of adults want to make sure that they're up to date on this vaccination because you never want to spread this to a child. They can die from this. So it's just important to know, like, okay, pertussis, you know, the whooping sounds, it could be deadly. So anything that can be deadly is, something that you want to make sure you're taking into consideration and getting those vaccinations for. Polio. So polio is a disabling and life-threatening disease caused by the polio virus. So the reason why we have not seen a lot of this is because of the vaccination. So just having that herd immunity has really helped because this went rampant during my grandparents when they were younger. My grandmother had it. So, before this vaccine, my grandmother, she can't walk and hasn't been able to walk the majority of her life because this virus, it spreads through your spinal cords, causing paralysis. And her body has not moved the same. So, just having that personal experience that I have had with my family, my grandmother would have wanted this vaccine, but it's just good to even know what it is. Not everyone knows what polio is, especially younger parents. They need that education. And the MMR, the measles, mumps, and rubella. So if we're talking about the measles, again, these are all preventable with the vaccine. We are talking spread through respiratory droplets, such as like if you're coughing or sneezing. So when you're coughing and sneezing, that like projects, I want to say about 6 feet, something like that, and aerosols all in the air. So it spreads like wildfire. Think about how fast like COVID spreads. It's the same thing. So the thing is, the measles, the symptoms don't appear for 10 to 14 days. So this could be spreading. It comes out like a cold. You're coughing, runny nose, inflamed eyes, sore throat, fever. Not everyone's going to know right away that that is measles. You're going to think it's probably a common cold, but then it's just going to get so much worse. And there is no treatment to get rid of it. It's just a virus. So you have to let it run its course, but the child is going to be really sick. Mumps is another viral infection. Again, it's going to have to take its course. There's nothing, there might be an antiviral for it, but it's mainly symptom relief. And then it's all that swelling. So you're going to have the swelling in the parotid glands, the salivary glands. And this disease is spread through saliva. So think about our little ones who are salivating all over the place, putting everything in their mouth. They're going to be spreading this very easily if they're not vaccinated. So a lot of these things I think are even more important in the daycare center and in schools because of the fact that there is a lot more exposure. Are we able to clean the toys that they touch every second, every time? Like they do it so quick. It's difficult. And even though we try to do our best, it's just, it's good to let parents know that this is why we do this. And, just so you know, again, it's the headache, fatigue, appetite loss. So those are some of the signs and symptoms of that. And you wouldn't necessarily know that that's it until you see the swelling. The swelling is usually the main indicator of the mumps. And then we have the rubella, so another viral infection. So this one has a distinctive red rash. And I was going to post it on here, but it's so sad. If you ever have time, and I'm not like smiling because if you ever have time to look at these things, they are awful. They are so awful. Like it looks almost like you would never wish this on anyone. And when you see these little babies going through, and these young children going through these things, either they weren't vaxxed or something was missed, or it's very sad. And some of these could be very life threatening. So just keep that in mind. But the rubella, that's a rash. It spreads directly through, again, saliva or mucus. So our children are very prone to this if they're not vaccinated, and through respiratory droplets, coughing, sneezing. So it just starts, symptoms often appear 2 to 3 weeks after exposure. That's a very long time to be a carrier. And then it includes mild fever and headache. So again, like it's not easy to tell right away. Um, you just kind of brush things off as like a little cold, right? But if they're not vaccinated, it could be something more serious. Hepatitis B and Hib. So hepatitis B, um, infants usually get this vaccine either right in the hospital or soon thereafter. And it's important. So this is something it goes to the liver. So anything hepatitis is a liver. This is virus, and it's spread when through blood, bodily fluids. Um, so when you're thinking about that, and you're looking at the symptoms, and a lot of times that would probably be later on. It would be the fatigue, the poor appetite, stomach pain, nausea, and jaundice. If parents have this right away, the children are vaccinated as soon as possible. So this is one that when you're looking at these things, other than the jaundice, the poor appetite, stomach pain, fatigue, like that, again, like you would think that that could be a cold. So it's not as easy to diagnose these right away, but it happens. Then you have the Hib. The Hib is, of course, I'm not going to say this right, Haemophilus influenzae disease. This is an illness that's caused by bacteria. And then some of these come into like almost like a ear infection form, which is more mild, where other forms of this are blood infections or something more serious, such as that. And, you think about that and like, how easy is it to diagnose some of these things, and God forbid a child did get a blood infection. Those are not easy to treat. So, you always want to think about this as what would be like the worst case scenario. And sometimes that helps put a perspective on things because you never know how it's going to affect someone. Then we have the varicella, which is the chicken pox. I remember when I was young, before the vaccine, I don't know if any of you have gone through this experience. I think it was like a friend or somebody had it, and my parents were like, "Oh, go send Heather over to that friend's house so she can get it." Well, I got it, and it was horrible. I had a fever. I had those pustules that were itching and pussing everywhere. They're like in my face. It was everywhere. And like, if I saw a child that had that, I think I would cry. And back then it was like, let them have it so then they have the immunity. Um, Thankfully, we have this vaccine. And even though some children still get it after the vaccine, it is way less severe than it would have been if they hadn't gotten the vaccine. So think about that. Even if I had 10 less pustules on my body, I would have been happy as pie. But that was an awful one. So just so we know what that is. because that was not a pretty scene. The pneumococcal, the PCV. So that's pneumonia. Um, Besides pneumonia, though, other types of infections can be sinus infections, meningitis. So meningitis, that spreads very quickly too. That's an infection of the tissue that's covering the brain and spinal cord. So there's that one, and then also this bacteremia, this bloodstream infection. So you want to make sure you're getting this PCV. That is super important. These, I would say, like the pneumonia, I'm like looking at this right now, would be like the best thing you can get out of this. And pneumonia is so scary too. People die of pneumonia. So, we just want to like be mindful of what this is and what it protects you from, because meningitis is common, especially, as children get older. When they're going to like camps and they're going to colleges, college dorms, things like that. So having this protection early on is just going to prevent that from happening, because once it happens, it's not a good scene. Hepatitis A, and then of course it could spread to other people. Oh my gosh, I start getting thinking about this stuff, I get all fired up. Hepatitis A, um, again, so this spreads from contaminated food, water, um, also causing fatigue, nausea, abdominal pain, loss of appetite, low grade fever. So we never know what kind of water or even like food, things like that we're going to ingest that are going to be contaminated. It happens. It just does. You never know when or where. Um, but it happens. So that's the protection for that. And again, it's liver related. So all these hepatitis is liver related. And then the flu. So the flu is always going to be, we all have the opinion about the flu. I personally, it's my choice. I always get the flu vaccine, but it is mandated for children to have it. And let me tell you a little bit why. And you want to let your parents know this as well, because it's so easy for everyone to say, I don't want it. I don't want it. My child gets sick when they get it. And for the state, they want to see that we have that by December 31st, that the children are not coming back after, was it New Year's Day, and not having this. They are not allowed to come back if they don't have the vaccine. So start telling parents, tell them now, that this is what's going to happen, so they can prepare themselves. A couple of things that I want to tell you: the doctors do run out of this vaccine. People are scrambling at the last minute, and then people are put on a wait. Those children that have to wait cannot return to school. So let the parents know that this is very serious. Um, when you're looking at these symptoms of flu, they're your basic symptoms, your common fever, chills, muscle aches, cough, runny nose, headaches, fatigue. But children under 5 are what they call the vulnerable population, children under 5, and then also your elderly and pregnant women. They can die from this. I want to say it was my husband's coworker, their child died from this. So, it's very important that we like say, okay, well, diarrhea, vomiting, things like that, a lot of these things cause dehydration. And if children are constantly dehydrated, they're not getting what they need, their electrolytes and their fluids in their bodies, they can dehydrate and die. It can infect other parts of their body and they can die. So when you talk about death, you know, we never, if it's something that can be prevented, we want to prevent it. And even if a child does get the flu and has the vaccine, the statistics are less of that happening. I'm not saying that it's never going to, I'm not going to say that it's hasn't happened, that a child has been vaccinated and has died from getting the flu, but the chances are very low. They're very low. So that is important, and especially to reiterate that children are of the vulnerable population, to when they get that they could die. And I hate saying that word, but it's the truth. That's the severity of it. So sometimes we have to be really real with ourselves when it comes to these things, and the education that we're giving to the parents. It's something that I've learned over time, that it's not the easiest thing to say, but it's the truth, and we have to say that. Required immunizations. So I put out this little chart. So we know what's required of our immunizations. We went through the chart, but there's sometimes these words that kind of pop up that you're like, what is that? And it doesn't just throw us off, it throws off the state inspectors as well. Sometimes they don't know what these things are also. So when we're looking at, some of the ones I see the most would be the Penticell and Pediarix, I think those are the two I see the most. And those are combination vaccinations. That's for the Pediarix, DTaP, IPV, and Hep B. Penticell is DTaP, IPV, and Hep. Then we get the MMRV. So a lot of times we'll have the MMR and the varicella separate. The first dose is usually separate. The second dose, a lot of times they combine it in this pro quad. So just so you know, that is the MMR and the varicella combined. Then we have the Prevnar, which is our Prevnar, or PCV13 is usually what I see it called also. That's our pneumococcal. So just kind of have this for like a little cheat sheet for yourself. The flu, I didn't put that on there. I should have, but it's usually like influenza, something similar to that. But I've seen state inspectors get duped with that as well. So anyway, that was a lot of information, but I want to thank you all for joining me today. If you have any questions, please reach out because it is a lot. And we just all want to make sure that you are supported throughout this. We don't all have health consultants helping us every single day with these questions or guiding us through. So this is kind of like a little bit of a information session about what it is that you're supposed to be looking at, and just kind of a different way of looking at things as well, just to keep the children safe in your program and to keep you in compliance with the state regulations. So thank you so much for joining me. I hope you all have a beautiful day, and I am going to try to figure out how to turn this off. So am I probably not doing it right? Stop here. Okay, everyone have a great day.